Been working with Dr. Chevalier for over 10 years now. I think it's maybe approaching 14 years. He's a brilliant guy. He's a nuclear engineer, and he was involved in nuclear fusion research at UCLA. And his specialty is laser spectroscopy. And he's since gotten involved in the effects of light on the human body. And that's how we got together to do some studies. So he's a brilliant guy. And in this study, we used a multi-channel EEG, a P3 system, for those that might be familiar with it. This was the pilot study, and then we later went on to do a double blind. And we wanted to work with people over the age of 50. So, no surprise, what happens as we age is that most people will experience some type of age-related cognitive decline. Some of this is through declines in mitochondrial function, changes in hormone levels, lack of exercise, poor diet, and other things. And we wanted to find out, could we reverse this? And, we think about how important this is, that as people get over the age of 50 and 60, one of the things they really fear is, am I going to lose my mental faculties? And if we could reverse that, so that people could be, 70, 80, 90 and above and not have any loss in their cognitive abilities, that would be a remarkable contribution, much less anything else. So here's an example of a woman, 77 years old. And session 1 is at baseline. And at 77, you really don't see very much stem cell activity in the body. The cells have reached what's called the Hayflick limit. They've stopped dividing. The integrity and the quality of the stem cells is extraordinarily poor. And this is when, when people get older, you get a broken bone, you may not really recover. Or you don't recover very well. So session 1 was at baseline. And what we're seeing with these red areas is a lack of brain coherence, or the ability of different regions of the brain to communicate with one another. And this has an incredible impact on health. Session 2 is after only 3 weeks of using X39, where we see a dramatic improvement in brain coherence, and the effect gets even better after session 3. And I asked Dr. Chevalier, what would it take to see this type of transformation outside of X39? He said, first, it never happens. And second, you would expect someone to be on very heavy nutritional intervention, exercise program, work for maybe 9 to 12 months to see anything even, remotely close to this. So he was extraordinarily impressed. And he has spoken at our conferences in the past on LifeWave. This was a gentleman, 67. Not everyone responds the same way. And in this case, he was wearing the patch below the belly button. And again, we can see the same problem with brain coherence in session 1. But again, after 3 weeks, there's definitely an improvement. And the improvements are going to show up as better mental clarity, better focus, and calmness, better sleep. And then, of course, after 6 weeks, we see that there is a dramatic improvement. So this is just all to say most people are going to see results the first few weeks. Some people need a little bit longer.